Why is drilling bone an important surgical skill to learn? Drilling of the bone is a fundamental orthopedic skill required in almost all surgical procedures on bone. It is as fundamental a skill as learning to hold a scalpel and make an incision in the skin, learning to suture a wound or tie a surgical knot. While most medical graduates and many allied health practitioners learn these basic incision and suture skills and put them into practice, most have never held a surgical drill and drilled a bone. Somehow the drilling of bone is considered a skill learned and practiced only by specialist orthopedic surgeons. Yet, in lower and middle income countries particularly, new medical graduates are sent to rural and district hospitals to fulfill their national duties. There, they are required to be frontline surgical providers in situations where there are often no subspecialist surgeons, performing life-saving surgical procedures like cesarean section and laparotomy, while facing an epidemic of open fractures from road traffic crashes and bone infections in children, with little or no practical experience or training in orthopedic procedures. The lack of trained providers and access to basic surgical infrastructure for early surgical intervention results in large numbers of children and young adults living with sometimes catastrophic preventable impairments, including amputation. These result in a lifetime of disability, exclusion from work and community activities, and stigma. Many young people coming into medical school in low-resource environments may never have actually had a drill in their hands and been able to practice the skill of drilling a screw into a piece of wood. They may never have experienced the tactile sense of a drill tip starting a drill hole without walking, of feeling the different degrees of softness and hardness in the material, of knowing how much pressure to apply, and of not plunging past the required exit point. Moreover, drilling a hollow cylindrical structure is particularly challenging, and most bones are cylindrical. How to find the center of the cylinder? How not to slip off the cylindrical surface? How to identify the feeling of going both through the near and far surfaces? And how not to plunge through? This table outlines the 44 basic surgical procedures considered essential and necessary to reduce the global burden of disease, as recommended in the disease control priorities of the World Bank. Among these are specific procedures requiring skills in drilling bone: the irrigation and debridement of open fractures with application of an external fixator, the insertion of pins for traction, and the debridement of osteomyelitis. These photographs show a simulator session with first-year surgical residents teaching skills appropriate for the treatment of osteomyelitis in children. A few simple surgical instruments are required, including a bone drill. For many of the young surgeons in the room, this was their first experience in knowing how to use these instruments and how to drill a bone simulator. Learning how to drill bone is a primary and essential surgical skill that should be in the armamentarium of every medical graduate in low-resource countries. The purpose of this educational program is to teach that skill and provide the learner with the tactile sense of what it is like to drill bone safely and effectively. Having confidence in these skills will go a long way to reduce the unnecessary burden of disease from neglected orthopedic trauma and infections, while also becoming the starting point for those going on in surgical training, where drilling of the bone is a fundamental skill in both trauma and reconstructive orthopedic surgery.